It's a pleasure to be here today, and I think the different pitches that have come before me, I think those are things that we experience and challenges that we have as well. So it's nice to see them presented here. And this really builds on the IPC issues that Heather was speaking about. So next slide, please. So really what we're talking about here is the problem. Obviously, we've talked about the prevalence and the impact of COVID-19 in continuing care settings, with 81% of deaths in Canada reported in long-term care. And one of the challenges that's been identified within some of our facilities is that appropriate or contained space for donning and doffing PPE. And along with that is, do we have that safe place for the staff to do that? As Heather also alluded to, there's a great deal of anxiety among staff and moral distress around bringing COVID home to family, but also not fear of bringing it into the facility because they've seen the devastating effects that can happen if COVID does come into the facility and the outbreak begins. Next slide, please. So what the idea is around this portable anteroom is a pop-up room, if you will, that can be set up easily outside either a resident room or maybe even as you come into the unit, where staff can don their PPE as they're coming in to the space, or doffing it as they're leaving that space as well. Some of our facilities are older and they don't really have enough space to do that. So this would kind of contain that area. Some of the things that we would need it to be, obviously, is easy to clean from an infection prevention control standards perspective, fit within some space constraints, and potentially be something that is adjustable, size adjustable. We have seen units somewhat like this when they're doing construction within a hospital setting, where it can, I guess, adjust and go up to the ceiling if they're cutting a hole in the ceiling to repair something, with HEPA filters to remove dust, that kind of thing. So something potentially along that line. Thought as well, if it was something that was see-through, so that you could also observe staff doffing their PPE, because we know that's also a time in the process where contamination can happen, and breaking that chain of PPE. And you could also incorporate into that some storage supplies as well. When we have residents who are suffering from dementia, they can also get into where the PPE is stored. Actually, next slide, please. So the current practice, staff would don and doff PPE in the open area outside of a resident room. For instance, there might be a cart with gowns, that type of thing, and a linen container for disposing of gowns. And again, this is where potentially residents could get into those supplies, and then having some contamination there as well. So this would, again, just provide us a safer space there. Next slide. So ultimately, the impact, what we're wanting to achieve is reducing the transmission of COVID-19 in long-term care facility, and also decrease that stress and anxiety for staff around spreading COVID, and that's a significant issue and concern for our staff.